Avenue Radio. The Urban League of Metropolitan Seattle, empowering communities and changing lives. The Urban League has been there to serve when our community is at its lowest. It's never mattered what the crisis was. The systemic oppression remains constant for those most vulnerable. Here at the Urban League of Metropolitan Seattle, we'll be temporarily adjusting our hours of operation and available services. If you are in need of resources, we recommend that you give us a call at 206-461-3792. To make an appointment, press 0 and speak with the receptionist. Walk-in hours will be from 10 a.m. to 3 p.m. Monday through Friday. And hey, we'll gladly work with you via phone as best as we can if you're exhibiting any signs of illness to assist you with information to save your home, find you a place to sleep, or connect you to job opportunities. The Urban League of Metropolitan Seattle. That's 206-461-3792.
What's on your heart? Are you exhausted at the lack of progress for people of color in business, politics, and life? This is Cindy Bright, the host of Heartbeat Radio. Each week, we explore this heart condition in the country that is affecting you and me. We have real conversations about what's necessary for change. It's time to change this dialogue. Will you join this Heartbeat weekly, Wednesdays at 7 p.m. on Rainier Avenue Radio?
If you or a family member are 55 or over and need nursing home level care, but want to keep living where you are, check out Providence Elder Place PACE. This program offers healthcare, housing, transportation, and recreational activities. There are no co-pays or deductibles, and it's covered through Medicare and Medicaid. Providence Elder Place PACE works to keep you healthy and in your home. Call 206-320-5325 or visit providence.org Elder Place. Providence.org Elder Place.
This is Paul Pearson, host of Star Time. And when I'm not stopping a Mercer Island street brawl, I'm listening to RainierAvenueRadio.world.
Been around for a long, long time.
What's going on, Rainier Avenue Radio? You are tuned in to a press briefing with Public Health Seattle and King County Dr. Jeff Duchin, who will be here to answer your questions on the mask lifting, continued vaccination efforts, and where we are at COVID-19 in general. We are waiting on the doctor to start his session, so until he does, stay right here on Facebook, YouTube, Twitch, the Rainier Avenue Radio app, and the Rainier Avenue Radio website, and we'll bring it to you when he starts the session right here on your community radio station, Rainier Avenue Radio. And if you got questions for the doctor, email them to us, RainierAvenueRadio.world@gmail.com, RainierAvenueRadio.world@gmail.com. See you soon.
microphone crazy today for people.
Looks like we've got Rainier Valley Radio and Honeybee. Hi, Tony. We're going to wait just a moment to see how many other folks we get to join. So we'll just hang out here for a couple minutes longer. All right, well, I'm not seeing other folks joining, which is understandable given the heat and everything else that's going on. So, Tony, this may be sort of a private briefing for you and your viewers, though we'll also be recording this and sending this to other media outlets. And so hopefully this can be useful for them as well. And my name is Kate Cole, and Christina Braddock, who I know you've been working with, put a lot of work into organizing this, but she is on a much deserved vacation day today. So I will toss it over to our health officer, Dr. Duchin, and we'll hear a few remarks from him, and then can take questions from you, Tony, and anyone else who happens to join us. Dr. Duchin, to you.
Thanks, Kate, and welcome, Tony, and anyone else who's joined at this time. Given the heat, I commend you for your resolve. I hope it's cooler where you are than it is where I am. I'm going to start with a few words about the heat and then talk a little about COVID and then welcome your questions. And this record-shattering extreme heat is really just the latest example of our climate crisis that's impacting human health right here, right now. Extreme heat is the leading cause of weather-related deaths in the US, and climate change is causing increasing frequency and intensity of heat waves and other extreme weather events. The health and economic consequences of climate change are only projected to worsen, and for this reason, climate change is undoubtedly and widely recognized as a health emergency, and reducing greenhouse gas emissions are literally a matter of life and death. I'm sure it won't surprise you that there is a large overlap between neighborhoods and communities of color that are at highest risk for heat-related and other climate-related health effects and those hardest hit by COVID-19. The impacts of climate change on health are significantly related to individual and community vulnerability and resilience, in particular to pre-existing health status and living conditions. And in the US, we know that these factors differ by place, race, and income as a result of inequities in the distribution of money and power, historical disinvestment in some communities, discriminatory practices and policies over time, structural racism, higher pollution burdens, and lesser access to resources for health. And therefore, low-income communities and communities of color are disproportionately affected by the health impacts of climate change. Now, with respect to where we're at with our COVID outbreak, things are looking increasingly better each week, which is a tremendous relief. And this is largely due to those of us who have been vaccinated. New cases and hospitalizations have been decreasing progressively. Over the last 7 days, we've had 66 new cases reported each day, which is down 84% from our peak in late April. COVID-19 cases are at the lowest level since June of 2020. And last year at this time, we were beginning to see the first hints of the summer surge that was related to people gathering when vaccines were not yet available. I don't anticipate we'll be seeing a large summer surge this summer, but I do think that to the extent that people who are unvaccinated get together, particularly indoors, without masks and without distancing, COVID will continue to spread, and more rapidly than ever in those settings for those people. And we are continuing to see improvements in the number who are vaccinated. 95% of our recent COVID cases, our hospitalizations and deaths are in people who are not fully vaccinated. And it's great that 72% of King County residents aged 16 and older have completed their vaccine series, and almost 80% have started it. All race and ethnic groups have 70% or more completing the series for people aged 15 and older, and 80% or more completed for those 65 and older. And this success is due to a remarkable set of collaborations between our amazing community partners, our healthcare providers, our public health team, and the good sense of the people of King County who are coming forward to get vaccinated. Our goal is to continue to bring cases down through vaccination across all communities, regardless of where they live in the county or regardless of their racial or ethnic background. Because of the gaps, however, currently, particularly in our Black and Hispanic communities, we are seeing a slower decline in cases in communities of color compared to the county as a whole. But we will be striving to reach a minimum of 70% fully vaccinated for all race and ethnic groups and in all zip codes, and ultimately even more people who are eligible vaccinated. Our current rates for those 16 and older for American Indian and Alaska Natives is 79%. For Asian Americans, 82%. Yet for Black and African American residents, 54%, and for our Hispanic and Latino residents, 56%. Native Hawaiian and Pacific Islander community members are vaccinated at 79%, and white residents at 68%. And our BIPOC-led community organizations and community clinics and businesses have been key to our vaccination strategy by sharing vaccine safety information, by making sure people have their concerns addressed, providing vaccinations in trusted environments. And we're very grateful to all of our partners and all of these organizations and community members who have been essential in this vaccination effort. Tomorrow, for example, there'll be an event, weather permitting, at Washington Hall in Seattle Central District from 3 to 7 p.m. No appointment needed. Vaccines are free. Now, let me say just a few words about our reopening and the new environment that we'll be in. On June 30th, the state of Washington will be lifting current restrictions, because the current levels of COVID-19 have decreased substantially. This is in large effect due to vaccination. And over 75% of Washingtonians over 65 years of age have received the vaccine, protecting them from severe illness. There will no longer be mandated restrictions on the number of people who can be in most indoor spaces or how far they must be spaced, with the exception of large indoor events with more than 10,000 people. Also this week, our local King County mask directive will end on June 29th. After that time, masks will still be required for people who are not fully vaccinated in indoor locations that are public. And even vaccinated people may choose to continue wearing masks in public spaces if they're at increased risk for severe infection or have an underlying health condition, or if they're in close contact with someone at increased risk, or if they just want to support mask wearing by unvaccinated people, or because they feel more comfortable wearing masks after so long, or they value its benefit in preventing other respiratory illnesses or against allergies. So where we are today, which is a much better place than we've been at any time since the pandemic started, thanks to our stunningly effective vaccines, tremendous safety record, and to everyone that's come forward to be vaccinated. And that's how we're going to get back to a long-term healthier lives and long-term healthy economy. But because so many still are not vaccinated, and because this is a new emerging pathogen for which we cannot precisely predict what's in store for us, it's important to remember COVID isn't over. The virus has been suppressed, but it's not eliminated. And those viruses that are spreading are more contagious and need to be taken very seriously. Going forward, as we switch from government-ordered population-level mandates, each of us will need to understand and be comfortable with the level of risk we're willing to take as individuals and for our families. Most vaccinated people will be at very low risk, but there are people who could not be vaccinated yet or remain at risk for other reasons, and it will be important to understand what's going on both in your community and your personal health so that you can take the steps to protect yourself and the people around you. So as we try and get back now to activities that we've missed and consider our own risk tolerance as much as possible, here's my advice. Get vaccinated. Get vaccinated and get vaccinated. If you're eligible, and also encourage others to be vaccinated. The more people are vaccinated, each community is better protected. Don't always have a mask with you. Don't throw away your mask, and make sure it's at the best quality and the best fit possible. Again, anyone who's unvaccinated should continue to wear their mask in indoor public places. Any business or organization can continue to require masks for their customers or visitors to protect them and to protect the workers. We really must all understand the importance of improving indoor ventilation, filtration, indoor air quality, because this is an airborne virus and is spreading even better than previously because of the new variants. We know how easily this virus can spread in crowded spaces. Indoor crowded spaces for unvaccinated people continue to represent a significant risk, and physical distancing and masks are very important in these settings for unvaccinated. So businesses and any organization with indoor facilities need to take steps to improve indoor air ventilation and filtration. And this will also be incredibly important as we transition into fall and winter, when the virus is expected to transmit even more readily, and we would expect to see surges among people who are unvaccinated. Finally, outdoors is better than indoors. As always, COVID-19 spreads much more easily indoors. So if you're planning or attending large gatherings that will include unvaccinated people, the risks are much lower outdoors. And finally, continue to get tested and isolate or quarantine if you've been exposed, if you've been around someone who's had COVID-19 or you have symptoms. COVID is still out there, although the risk is much lower than it's ever been, and the new variants are even more contagious. So with that, I am happy to have a discussion as long as we can all withstand the heat.
Great, thanks so much. We'll open it up to Rainier Radio to see if you or any of your listeners have passed along questions. Rainier Radio may just be recording and live broadcasting, but not have questions to ask. So I think with that, we will wrap it up. Dr. Duchin, any final comments you want to close with?
Was very efficient today. This is a very unusual time where we're faced with two public health emergencies simultaneously. A global climate emergency that is causing a deadly heat wave throughout much of the country currently, and a deadly COVID-19 pandemic that is thankfully has a cure, in that it is now a vaccine preventable disease through vaccination. I wish we had a vaccine that I could offer you to protect us from the global impacts of climate change, but we don't. It's going to require significant effort from all of us, and I encourage everyone to understand the steps that we can all take as individuals to address the long-term impacts of climate change and make sure we avoid the most catastrophic impacts that will occur if we don't change our ways very quickly, and also to understand what you need to do now to adapt to these types of events, which inevitably will occur based on the heat that's already in our global environment from past years of carbon emissions, greenhouse gas emissions. With respect to COVID-19, please continue to be vaccinated if you're eligible. That's the way you, your family, and your community will get back to your pre-COVID life and ways in our pre-COVID economy as quickly as possible. And finally, just remember that for those that can't be vaccinated, precautions are still recommended, particularly around the upcoming holidays when people will be gathering. Do so outdoors if there will be unvaccinated people, and if there will be indoor gatherings with unvaccinated, mask and distancing and good ventilation will be very helpful in reducing the risk for everyone. With that, I hope we're through this heat wave as quickly as possible with as few illnesses and deaths as possible, and I look forward to talking to you soon.
Great. Thank you so much, Dr. Duchin. Take care.
This is Paul Pearson, host of Star Time. And when I'm not using my GPS to navigate the land, I'm listening to Rainier Avenue Radio.
You probably have questions about COVID vaccines. Here are some answers about how they're being made.
How are COVID vaccines being produced faster?
Usually, vaccine testing and production are separate steps. But because of the pandemic, vaccines are being developed on parallel tracks. So both steps are happening just at the same time.
How are the vaccines being tested?
Right now, several different COVID vaccines are in testing. Each go through multiple clinical trials with up to thousands of volunteers.
How do vaccines get approved?
Not all COVID vaccine versions will make it to the final stages of testing and approval. Produced vaccines that do not pass clinical trials will be destroyed. But for those that do pass, a team of medical experts will examine test results and possible side effects. If the vaccine is effective and safe, it gets approved and gets to you. Go to covidvaccinewa.org to learn more. A message from the state of Washington.
We got the feeling now. Yeah.
R&B, soul, funk, 50s, 60s, 70s, 80s. We give you all that and more on Star Time. Join me, Paul Pearson, for a 2-hour trip through the history of R&B. A new episode every week on Wednesday at 2 p.m. Come and get the feeling on Star Time on RainierAvenueRadio.world.
Yo, what's good? It's D Money, and you should definitely check out Fresh Juice every Wednesday, 9 to 11 Pacific, right on Rainier Avenue Radio.
With pint-sized Patron, P-Treasy to Don. Y'all be sure to clean your mirrors as we play brand new hip-hop and R&B from locals and worldwide.
Yo, it's ID Yourself, a.k.a. Malcolm Flex. Make sure you check out Fresh Juice every Wednesday, Pacific Standard Time from 9 to 11 p.m.
And to get those exclusive interviews that we be doing.
Sipping a brand new fresh juice every single week.
Yee! Every Wednesday, 9 to 11, Rainier Avenue Radio.
Yay!
Juneteenth live on your community radio station, RainierAvenueRadio.world. June 19th, 2021. From 11 a.m. to 1 p.m., we will be live on location at Atlantic Street Center's 20th annual celebration at the Rainier Beach Public Plaza. And from 1 to 4 p.m., we will be live from the Othello Park 5th Annual Community Juneteenth Festival presented by It Takes a Village, with music, history lessons, community services, resources, interviews, and entertainment. Watch on Rainier Avenue Radio's YouTube, Facebook, and Twitch. Listen on our app, website, TuneIn channel, or smart speaker. Juneteenth live in the community on your community radio station, RainierAvenueRadio.world.
You're listening to RainierAvenueRadio.world.
Welcome back to Rainier Avenue Radio.world. It's me, Tony B, your host of the impacts of the coronavirus on South Seattle and surrounding communities. Yes, we started doing this show March 13th, 2020, every week, and we've continued to do it. And it looks like we will continue to do this because the impact of the coronavirus, well, it's still here. It's still impacting us. We're still working our way through this situation. Even so, some of the things are coming back to what folks would like to call normal. There are things that have probably changed forever. And joining me on the show right now, I want to make sure that we have this connection here because sometimes, you know, through the internet, things can get a little wonky. Dennis, are you there?
I am. I had to call in by phone. I couldn't get my computer to work. I hope you can hear me.
I can hear you, and yeah, I hear
Oh,
you
great.
very well. All right, cool in the gang. So my guest is Dennis. Is it Worsham? Am I saying the last name correctly?
That is correct. That is
All
correct.
right.
Thanks for asking.
And Dennis is the newly appointed interim director of public health, Seattle King County. As I mentioned, brings nearly 30 years of experience in public health, policy development, and advocacy. Dennis previously served as the Deputy Secretary for Health at the Washington State Department of Health and in various positions at Public Health, Seattle and King County, including Chief of Staff, Chief of Policy, Community Partnerships and Communications, Regional Health Officer. You've done a lot.
It just tells you how old I am, Tony.
Well, you know, because what I just started with there in that introduction of you, you know, Dennis, I'm going to start off by saying, well, first I should ask if you have a passion for the health and well-being of our communities. I'm not just going to say, first I'll start with that, then I'll get to the real question, because I know the answer is going to be yes. But we'll just put that out there first.
Yeah, of course. You know, it's so interesting. You know, I think sometimes we often too quickly start with what our pedigree is based on our experience and work. And I generally am a person who likes to start with what I value. And I have to tell you, I came to public health, kind of fell in by accident to public health. My education is really around health services administration, and I just felt a call to the mission of public health during the AIDS epidemic and crisis in the 90s, and came to public health because it was so community driven and what it was doing, and it just called me as a community member to stand up and do something more. And I fell in love with the mission of what they do, who we are, and what we do in the community, and the caring about the health of the community and individuals, and raising those voices where we need to in this process.
Okay, and I wanted to give you the opportunity to say that rather than just take it for granted. So again, Dennis, as the interim director during this period of time, which we all know where we're at, how do you establish goals, or do you establish goals? Do you look to keep consistency in the direction that we're heading? Are there things that need to change with information coming at you on a daily basis, and that may change on a daily basis? How do you handle the position of being interim at this, you know, where things may have to be set long term?
Yeah, that's really a great question. I think for as you just allude in your conversation here, is it's hard being an interim, right? As because you're holding a seat, and sometimes perceived by others until the new director is hired. I'm hoping what I bring is I have a lot of relationships and, of course, understanding of public health. My position that I held previous in coming into this current role has been within the department and really over infectious diseases. And given that one of our major crises right now, two things that we're really leaning into is both the work around our pandemic, around COVID, and certainly racism as a public health issue. And both of those things have been near and dear to my heart and really important. And I'm just carrying on those particular areas of bodies of work. But also, you know, as health changes in our community on a daily basis, on a weekly basis, it's important to be able to be adaptive and responsive to those things that are being raised by the community, that we're seeing through our data. So there are things that we will shift, but there are some things that need to be consistent. And certainly our response to COVID and getting to the other side of this, leaning even more in and building on the work that we've done around racism as a public health issues, those things will be consistent. Hopefully we continue to learn in our partnership with you and community and others to get better all the time in that work.
And you know, Dennis, everybody doesn't have time to keep up with the latest news because we get bombarded by so many different things, and then just trying to live day to day. So there are folks out there might be going, well, wait a minute, interim director, what? So I'm going to get into public health Kool-Aid a little bit here.
Okay.
Why do we have an interim director in the midst of trying to get through this pandemic?
Yeah, it's a good question. We first of all, I work in the governmental system and work under Dow Constantine, who is our leader in the executive branch, as his work is important and continues on in the community. Patty Hayes, who you've had on here before, has been the Director of Public Health for 7 years, made a decision to step down and retire. And in that process, we wanted to keep a really open process and a competitive process in doing a national search for a new director who really aligns with the values of what we have here in King County and certainly with public health. In order to do that, as you know, those recruitments take a long period of time, and we didn't have that grace period and able to do that in Patty's retirement time and trying to find a new one. So in bringing an interim is really trying to keep consistent practices, and of course, being here in King County and having been for many years and a resident of King County, as understanding the values of the people in the Northwest and really trying to hold those values until we can get through a competitive process. We're going to lift the voices of people in the community. When I was announced in partnership with Executive Constantine, also was announced an advisory group made up of both community and other electeds members who will help select the new director for this role, and also in how we post it. So that process takes a while. So rather than to have a period without a director, I get to step in as an opportunity as an interim director and hold the seat while we do that national search.
All right, and I'll just share this with you. If you're unfamiliar with Rainier Avenue Radio, we super serve South Seattle, and because of the pandemic, surrounding communities as well. And that may be a small portion of the state, but I'm sure you've heard the starfish analogy. So we really appreciate it when Patty would come on and Jeff comes on and they talk to our community, because it makes a difference, Yeah. And again, I use this stuff. It makes a difference to us. It may not, and I say that to say, in the search for a new director, how important is it for this new director, and maybe you don't have this information, or maybe it just be your opinion, to understand that we have a lot of different folks in this community, whether you're talking about ethnicity, or if you want to call it race, or if you want to call it social economic status, and it's hard to reach everybody with one message. How important is it for the new incoming director to have that understanding? And I'm assuming at this point, and you can surely, take the microphone and share, because I'm thinking that if you're in the system, you get that. And I appreciate your willingness to come on and have this be your first interview that you're giving to anyone.
Yeah, you are my first interview. So I'm grateful to be here with you and to answer that. And I'll give you my opinion. I'm a pretty straight shooter in this area. What I know about public health and what I love about public health is we are every community's local public health. And that means that we need to be in touch with what is going on with the health and the well-being. The World Health Organization defines health more than just the absence of disease. It defines health about being both spiritually and physical well-being as well as the absence of disease. In order to really know what that is in your community, we do that by really looking at our data, but that data can be a number factor about disease reports or lack of disease reports, but it is also a qualitative place, and it's about the conversations and the concerns of the community that are being raised. And for any director or anybody who is serving the community in a public health role, is they have to know and have the voices of the community in order to drive where we need to be focused in creating that space of health and well-being for our community. So it is important for people to understand what's going on in your community, understand the voices and the concerns of the community, so we can address those collectively, because our work has to be done in partnership.
All right, I just wanted to get in the public health mix a little bit, so we
anytime
to these things. So I want to ask you some, I guess you would call them more policy related issues. Give us an understanding of what this 70% goal is, what that means, if we're close to it, how it changes everything. Just break that down if you can.
Yeah, that's a really, really great question, and and it's a complicated answer, but I'm going to make it as simple as I can. So hold me to that. All right. In public health, this pandemic is a new thing, right? It's an emerging disease, and we're learning about it. We've learned a lot about it in the 18 months that we've been in a place of response. You know, we generally try to get to a place of on immunizations when immunizations are available is a term you probably have heard in the community where we talk about herd immunity. We try to get to a certain level of immunity within the community. And what that does is it interrupts that transmission from one person to another. And when we can interrupt that transmission, we have a better chance of defeating that battle, if you will, with the spread of that virus. So the goal that we set out from the very beginning was really trying to reach 70% of those eligible to be vaccinated is to get them vaccinated, to get to a higher immunity within our community and to interrupt the transmission, bring down hospitalizations and bring down illness, bring down death in those areas. Now, what we're learning about this virus is that we're probably going to need to get above 70%, but it was the goal that we started with. And we really led from King County, that goal being really led from also an equity goal. It wasn't just the King County as a whole, but it was with each race and ethnicity group is to reach that 70%. And so as a whole in King County, the celebration is that we're reaching that 70%. We made the announcement this week. We actually reached that number of 16 and older in King County of who've been now vaccinated, completed their vaccine series for really trying to use that as our tool in interrupting this transmission. So it's a great success. And as you know, you look at whole numbers, but if you get into the individual numbers by different race and ethnicity groups we've got a couple pockets where we still need to do some work. And just because we've hit the 70 doesn't mean we're done. We probably got to push closer to 80-85% in order to get a better herd immunity within our community.
Now, having said that, that's an overall number.
Yeah.
Do we know, or do you have information about the status of reaching these numbers in Black communities, in brown communities, in Pacific Islander communities, in indigenous communities? Are we hitting the 70% there? Yeah.
That's a great question, and this is why I love public health, is because we can tell you, and I want to start with this because I think sometimes we start from a place of deficit, and I want to start from a place of celebration, and then say we got to keep going, right? So we have reached 70% across all of our race and ethnicity groups, and some of those even higher than 70%. When we look in particular at our Latinx community and our Black and African American community, we have reached 50%. And I want to acknowledge that is an accomplishment, that we have reached 50%, but it's not the goal. The goal is higher than that. The goal is the 70% and higher in these communities. So I want to take and build on the success of the 50%. We're halfway there to getting everybody vaccinated. But to close that gap, we still have a ways to go in our Black and African American population, our Latinx population. It's the only areas that we are seeing lower than 70% in our data.
Mm-hmm. So the reality of it is that in Black communities, we're at 50%.
50%.
50%.
And Latinx, about 50%.
And Latinx communities, about 50%.
That's right.
What do you think can be done? And again, I know there's no silver bullet that can be done to increase that. And what do you see as some of the hindrances to making that happen?
I'll answer your question, but I also want to flip that question back because I think that having some insight, from you and your connection to community might help us as well in this area. So, well, first of all, I just want to acknowledge that part of the challenge, right, is that it's a new vaccine, so there is some vaccine hesitancy for folks. Just naturally. And in particular, I think and acknowledge that there's mistrust in the healthcare system and the governmental system for really good reasons for this really long systemic racism that we have seen in this country. And we've got to continue to bring out the important messages about how effective, how safe, that message to the communities and be able to get there. The best way we're going to get there and really close those gaps is it's going to not be, as you say, the silver bullet. It's going to be different modalities in getting there. We're going to need to really partner with community partners, people who are trusted voices within that community, from both the healthcare system, from community-based organizations, from faith-based communities, in order to be able to have them stand with us and to be able to reach into the community and let us come into the community, let us provide those services where people are gathering, whether that's in a place of faith, whether that's in a community gathering space, whether that's a place that people celebrate, whether that's a place that people work. But we've got to bring those to the community, and we've got to do that in partnership with a variety of partners who are trusted voices within different parts of our community.
Well, I'll tell you, Dennis. I don't tell people what to do because I haven't walked in their shoes.
Right.
And I know that that's a big deal, walking in somebody else's shoes and what they've been through. We can take examples from just finding out about the massacre that took place at Black Wall Street,
Right.
and how that silenced a community and what that left that community with. If you don't understand that, then you're not gonna have an easy time figuring out why nobody said anything. Well,
Right.
why did everyone just keep it quiet? Well, you didn't have 36 blocks of your community burned down to the ground.
Right.
And then the next day, the headline was "Blacks killed 2 people." So to say that is just, I don't tell people what to think. However, I know that immunizations are just down across the board, whether you're talking about measles or whether you're talking about whooping cough, because of what's happened with the coronavirus. And I don't want to see our community get decimated by things that we can prevent. So that's just my little public statement on that, my little soapbox moment. Comment on
No, I appreciate it, Tony. I just want to call out, I just want to pause for a moment and just say I understand, and I do think it is, from a place of public health, and we've also, as you know, and have had conversations with leaders within our public health sector, is that racism as a public health crisis is really a crisis. And we understand that when it comes to healthcare, when it comes into healthcare delivery, and it comes into immunizations, that we have a history that is not good in this country. And that is part of a challenge that we have to overcome, and we need to own and acknowledge as we step into this place and speak our truth and really our shame around that part of our history. And really trying to be honest and authentic about how we show up and about what we're learning in science and what we know and what we don't know. And so people can make those informed decisions about where they're at. Part of the success, I will say, as I said, I wanted to highlight some of the successes as well as not just understanding the deficit, but in the Black and African community in King County, of our 50 and older population who has really been most vulnerable to hospitalizations and death, 70% of Black residents are vaccinated and made that decision to get vaccinated. And because of that, we're seeing, less hospitalizations and less deaths. So it's really the younger population, the below 50, that we need to speak in and step into that space of being able to have these conversations and understanding what those barriers are and what those fears are, and to be able to address those for folks as they have them, because we haven't walked in their shoes and we don't know what their experience is.
And again, my guest is Dennis Worsham, the interim director for Public Health Seattle, King County. We're just getting an update and having a conversation about where we are at right now. Let's talk about what folks are referring to, and maybe this is what they are, variants. And we're hearing something now about the danger of variants that are out there. Can you share information? We've heard something about a Russian variant, a European variant. Does the vaccine that we're taking now protect against those? Have you seen changes in hospitalizations based on those variants? Just whatever I may not be asking the right questions, but I think you know what I'm trying to get at here.
Oh, I think you've done your homework. So you're asking the right questions. So yes, let's talk about variants. So, when we, first of all, it's important to understand, we've come to know this, as the COVID-19, and, but, those letters mean something, and what the COVID is a coronavirus, and coronaviruses continue to evolve, and they continue to change, right? They are looking for a way of surviving as a virus and to live, right? And so you'll see these variants or these spin-offs as it tries to adapt to different environments. What we know right now is that in our region and across the state is over 80% of the new confirmed cases are of one variant or another. that it has changed, it's evolved. The original COVID virus that we have identified as part of this epidemic has changed, and we see it evolve differently in different parts of the world. And then, of course, we're a global community, and then it spreads. So we are seeing variants, and what we know is each of those variants that kind of spin out, that there are some that are more dangerous than others. And so there are a group of these variants that we call variants of concern. And they're ones that we're keeping a very close eye on. But what I'll tell you about what we know about the variants, and in particular in the news in the last few weeks, has been what we call the Delta variant. And it's what originated in India, and it has spread very rapidly through the UK and parts of Europe. In fact, UK has gone in the other direction and starting to close things back down. What they're seeing in their community is about over 60%, pushing 70 now, of their new cases are of this Delta variant. It's highly contagious. It spreads much faster. We used to have a term in public health called an R0. It's mean for every person who's infected, tend to infect 2 or 3 more people. What we're seeing is that R0 is increasing with these types of variant, which means that it's much more transmissible than what we saw at the beginning of this virus. The good news is that the vaccines that we have approved and that we are using in our community are shown to be effective. Against these particular variants, and they still provide a protective factor. In fact, the Delta variant is about 88% effective in really shutting down the virus. The thing that's slightly different about this Delta compared to some of the other ones is that the protective factor on that first vaccine in a 2-part series isn't as effective as it is against other variants or the original COVID virus that we did see. So we're concerned, we're watching these very closely, because if we don't shut down this virus, it will continue to mutate, it'll continue to spread, and more variants will spin off. So it's a great question, and it is where we're at in the part of the epidemic that we're concerned about it. So vaccines do work, masks still work in preventing those, and we have to really address like indoor air quality and get better with our ventilation and stuff, because those things really still work against these variants. So there are ways to protect ourselves, and vaccines being the number one way of doing that.
All right, I got to ask you some speed questions here because we're out of time. Although I do appreciate your in-depth answers. But just quickly here, I was recently in Las Vegas. Nobody was wearing masks. I was in Arkansas. Nobody was wearing masks. I'm guessing that the virus does not recognize state lines. So what's the deal with masks? You mentioned masks here. They're going to be mandatory. They're not going to be mandatory. What's the deal with masks?
Yeah, so masks have been, it's interesting. At the beginning of this, masks weren't widely available, right? We call it PPE, personal protective devices, just weren't very available. And what we do know now is masks are effective if they're worn. It's got to be tightly fitting over your nose, and it's important. It's important deterrent in helping to stop the spread of the virus. So we've used that as a mandate in this county for a period of time until we reach the 70%. So when we're fully vaccinated, that mask mandate will change. If people are unvaccinated, they still need to wear a mask. That does not change the directive for people who are not vaccinated. They still will need to continue to wear a mask. If you're vaccinated, you can take your mask off. If you're comfortable doing that, you don't, people, I'm still go into public and I still wear my mask, although I'm fully vaccinated, because that's where my own comfort level is. Some people have compromised immune systems, may continue to wear a mask, although they're fully vaccinated, just for protective factors. But we're seeing as we reopen more, the mask mandates are coming down. CDC came out, showed that the effectiveness around vaccines is so good that you can take masks off around different environments, outdoor environments in particular, and in some indoor if you're with other people who are unvaccinated. But if you're unvaccinated, you still need to wear a mask. That's still a requirement in this fight against this disease.
What about the state reopening that's slated for June 30th?
Yeah, good question. Good question. So we'll see if we'll get there. I think we're on a good trajectory, but vaccines have really slowed down. The goal that the state was trying to arrive at is an initial vaccine for 70% of those who are 16 and older. Not quite there yet on that initial throughout the state of Washington. We have pockets of the state that are very, very lagging in getting vaccine uptake and going. But the goal is to hit that 70%. So on June 30th, what will happen if we have reached that 70% of initial vaccines is the state will be removing some of their restrictions. Masks still will be required again for people who are unvaccinated, but you'll see them like in stores and other indoor places where those restrictions will go away. The exception will be around really mega events like 10,000 or more. You'll see like sporting events or concerts. If they're having 10,000 or more, they're going to be limited to 75% of capacity unless they do some kind of a vaccine verification. If they can do a vaccine verification and people don't have a vaccine and they were required to wear a mask, they can move up to 100% of their occupancy. But most restrictions will be coming down as we move into this reopening.
Really quickly here, what are your goals during this interim period? You kind of talked about that a little bit from a social level, from a policy level. What are your goals during this interim period?
Yeah, I will tell you, I'm been just a couple weeks in the seat, but I'll tell you some initial ones out. The one is to get us to the other side of COVID, is very, very important. Really continuing the good work we have done in King County and working in partnerships in the community around racism as a public health crisis, really leaning in, making a difference, really from a systematic process, from a governmental process, is how do we take those systems down that really have been oppressive and really have shown up in a white supremacy culture that we need to undo. Continue that work in partnership with community, raising the voice of our community in that process and that work and getting to the right outcomes. The other thing I'm really interested in leaning a bit more to as we're learning a little bit more is really around looking at, we have a major problem with our fentanyl overdoses that have been going on here in King County. We're almost at our overdose deaths in King County 6 months into the year that we were by the end of last year's of all overdose combined. So I do think we're going to need to step stronger into that space and really help protect the lives of people. We're seeing people who are under 40 who are dying at a faster rate through overdose deaths. And it's really, it's another pandemic that's going on within our community that we need to address.
And final words, Dennis, that you'd like to share to our audiences right now.
Well, my final words were thank you for the time. Thank you for the partnership that you and community members and people from the Black and Brown community that have really got us to the point we are in this vaccine. We're so grateful for that. And lastly, just to say happy June 19th. And I'm so happy to see that yesterday our federal government finally caught up with this long tradition of a holiday and now recognize it as a federal holiday that's been signed by our president. I'm just couldn't be more happy and wish everyone a happy June 19th.
Is your name in the hat for the final position?
We haven't posted it yet, so we'll see when it comes there. But I'm certainly enjoying the opportunity to be in the seat while I have it, and will do my very best to represent the values and the voice of this community while I'm here.
Well, thank you, Dennis. It's been great talking to you. Best of luck to you, and good luck in the search. I'm just saying you should put your name in the hat, man.
Well, thank you, Tony V. I will call you as one of my references. See if it's okay to list you.
Well, that and a quarter might get you a cup of coffee, but again, maybe not. And speaking of Juneteenth, Dennis, before you go, if you're looking for something to do, Rainier Avenue Radio is broadcasting 2 Juneteenth events. On Saturday from 11 to 1, we'll be broadcasting live with Atlantic Street Center's 20th celebration of June. 20th celebration. I said it again, 20th, because a lot of folks didn't find out about the celebration until a couple years ago. And that'll be at the Rainier Beach Community Center. So that will be happening. And then from 1 to 4, we'll be at Othello Park for the It Takes a Village Juneteenth celebration. So we're doing 2 Juneteenth celebrations. I think the more merrier.
Yeah.
And so if you can't make it down there, tune in to Rainier Avenue Radio and get some information about Juneteenth, the history of Juneteenth. And then I'll just follow that up by saying that we're also having a streaming event at Pier 62 for Make Music Day. We're not actually encouraging people to come down, but we'll be on the pier, and I've had to deal with those COVID restrictions. And if you do come down, we're going to be doing contact tracing if you want to come on the pier. But we're going to be playing music, Seattle artists, Seattle musicians, interactive opportunities as we try to, again, get on the other side of this COVID thing while still managing and making sure we stay safe and healthy. So There you are. That's it. That's all the time that I have. That's going to do it for the kid. Dennis, thanks for joining us on
Thank
the
you, Tony
show.
B.
And remember, coming up here quickly, we've got more community broadcasts on the coronavirus for the next hour. And whether you believe you can or whether you believe you can't, you are probably right. I'm out. Peace. All right. Can you hear me?
Yes, I can hear you. Can you hear me okay?
Awesome. Fantastic. Welcome to Rainier Avenue Radio and our special broadcast of the impacts of the coronavirus on South Seattle and surrounding communities. We do this show every Friday and actually have been since March 13th of 2020. Well, I am excited to bring a guest on today who I think is one of those we call behind the scenes folks that you should really get to know about and the role that they play in our community. So I'm going to bring on right now Stacy Pham. Stacy, good to have this opportunity to talk to you. And you're from the Public Health Seattle and King County. Why don't we start off? We're going to end up talking about communicable diseases, epidemiology, and immunizations, and that's a mouthful. But I want to get started by finding out a little bit more about you first. Why don't you tell us a little bit about your background and who you are?
Sure. Thank you for having me, Tony. So my background started with with undergrad. I went to Cal State Fullerton in 2002, 2006, and I received my bachelor's degree in human services. It's just like a fancy word for social work. And so I became a social worker for 3.5 years. And then I served in the Peace Corps shortly after I graduated with my bachelor's degree. And I served in 2008, 2010. And then that's where I really, my love and my passion for public health was really solidified. Upon returning to America, I pursued my master's in public health, and I graduated, and I subsequently worked in a number of African countries working in the field of global public health for about 4 years. I have a total of about 10 years of social work and public health experience.
Wow. I think that your unique skill set qualifies you to be in this position that you're doing right now. Again, a very important position. So if some of you are wondering, okay, well, wait a minute, communicable diseases, epidemiology, and immunizations, how and why does this impact and affect my life? I mean, sounds interesting. You know what? So I want to start with taking each one of these separately, just so that we kind of define what we're talking about here for folks as we move into this. And I'll start with communicable diseases, and you don't have to say it fast 3 times. Communicable diseases. What are communicable diseases? Just as an example of what they are and what they do.
Okay. Yes, communicable diseases is definitely a tongue twister kind of word. Communicable diseases are diseases that are transmitted from one person to another person. I worked with communicable diseases when I worked overseas. Some examples are malaria, tuberculosis, and we also have diseases here. Currently we have the coronavirus, which is a disease that is pretty much affecting all aspects of our lives.
Mm-hmm. And this other one, epidemiology. I think I got it right. Epidemiology. And epidemiology, I do know this much about it, that it is kind of a cornerstone of public health. And if you haven't, if you're not familiar with the word, or you don't say it all of the time, you are being impacted by epidemiology. So why don't you explain to us, even though once you do, we're going to understand what it is and why it's a thing. But epidemiology, what does that mean?
Epidemiology is pretty much the study of diseases, the study of like incidence of rates, and we really study disease and how it's affecting the population. There's a lot of numbers that come into play, as well as different variables like which like what's the incidence per population group, or like different types of disease burdens, how it affects populations. And so epidemiologists, they really do a lot of research in the study of diseases, and that information and data and research is used to for fancy charts and graphs and all that, as well as to protect the people and to find different ways to develop programs that would most effectively improve people's lives.
Mm-hmm. And then finally, and we've heard a lot more about this because of the coronavirus, immunization.
Yes. Mm-hmm. Immunization, that word you've been hearing, yes, quite often because of coronavirus. Immunization is, I just want to preface by saying that I'm not a doctor by any means. I have my master's in public health. I've worked with immunizations in the form of like being a program manager for immunizations perhaps, and like different types of health programs. But immunization is where they take a weekend, they create I believe like it creates a weekend part of the mRNA or different types, and then they make I'm sorry, I'm a little nervous, I'm sorry, but they make like a immunization. They make like a vaccine, and vaccine is then injected into people if they are open and willing to it, and then the body starts to build antibodies to react to that certain type of disease. And the person therefore gets develops like resistance to that type of a disease because of that vaccine. Like what we have with coronavirus, mRNA is taken from is studied, and then people like myself, we get the vaccine, and our bodies have become they build antibodies, and we drastically reduces the chance of catching coronavirus.
And so again, I think what you do is really important, and people may not know about it. Again, kind of behind the scenes, which is why I'm really excited to be able to have you here. Now, again, a lot of these terms for you are probably redundant because it's a world that you live in. And so now I'm finally getting to your title, Disease Research and Intervention Specialist. But I had to talk about that other stuff, to kind of set the table a little bit. So as a disease research and intervention specialist, what does that mean? What do you do? For everybody to go, okay, well, what is that? What are you looking for? What kind of job is that?
Yeah, that does sound very interesting. So simply put, I'm like a disease detective or a disease investigator. My job entails speaking with people, talking to them, and then helping them to kind of go back and talk about when they got sick. And then we go through perhaps when they got sick, and we talk about what possibly could have made them sick. And that really depends on the type of condition I'm investigating. For example, we have foodborne illnesses. If I were to talk to someone who had who was diagnosed with foodborne illness, we talk a lot about different types of foods, where they ate that food, what the name of that food is, and therefore I have an idea of how they got sick or what type of food they ate that was contaminated. And if need be, then we at Public Health would take action and act. And if we see, for example, if we see that one person ate at this restaurant and they became violently ill, like within a few short hours after eating there. And then we talked to another person and they ate at the same restaurant and they also became ill. So we see that there's a common thread. They ate at the same restaurant. The symptoms are similar, their onset symptoms. And then we would need to take action and definitely intervene in that regard, because we do not want more people getting sick.
Yeah. And so because, again, of the coronavirus, people became aware of identifying, tracking, was a big thing that we started learning about. Where is it? Who's being impacted by it? How many folks in a geographic location are being impacted by it? But it's not just the coronavirus. Coronavirus is just a latest thing here. So tell us, Stacy, why this is important for communities to know, for people to know. And I may be oversimplifying this, but you keep track of diseases, and you kind of figure out where there's hot spots and if they're flaring up, and if they may be even in certain locations. And I might be oversimplifying that, but is that about right?
That's about right. I think you have I think that's like a really good way of just giving the abridged version. So at Public Health, my job is to investigate diseases, and that involves talking to people. And from talking to people, I would gather information and data. I would gather, what they ate, different types of foods they ate, different types of restaurants where they ate that food meal, different types of stores, and from there. We collect data, and it's input into the system that we have at Public Health. And we have another department, the Analytics and Informatics department, and they use the information. They can run certain analyses to kind of find out, okay, perhaps this type of condition affects a lot of people who have been homeless. And from there, we have an understanding, okay, it seems like there has been an increase in this type of illness in the homeless population. What do we need to do about it? What type of interventions can we discuss, and what interventions are most effective? Like right now, we are in the midst of an outbreak of Shigella. The Shigella outbreak has affected, I believe, more than 100 homeless individuals. And so we are looking at it and seeing what we can do to work with the communities and the cities to help that unfortunately very vulnerable and disenfranchised populations.
Mm-hmm. And so you gather this information, and where does this information come? Because again, I think there is a department like yours in various counties, right? Each one has its own.
Correct.
Where does all this information come? How do you find out this data?
Okay. So we have a system, and then so normally what happens is that we get reports. Laboratory healthcare providers, if they see that they have a patient who tested positive for a condition, then they would notify Public Health, because certain conditions are notifiable and it's like mandatory. The person gets, we at Public Health gets notified, and myself, an investigator, we take on different cases. We contact the person who's sick, and we talk to them, and then from there we just extract information. So the information actually comes from the person themselves, the case. And I want to emphasize that the information that we extract is completely confidential. The information, we do not use their names or date of birth or anything. We use the disease, and it's just for data analysis purposes, and it just helps us to guide our program. And essentially, the information is just used to do data analysis, and helps to guide our programs or interventions, and it really helps other people from getting sick. And that's the ultimate goal, is to protect the public.
You're listening to Rainier Avenue Radio. It's me, Tony B. My guest is Stacy Pham from Public Health, Seattle and King County. We're talking about communicable diseases, epidemiology, which again, cornerstone of public health safety, and immunizations. My guest is a disease research and intervention specialist. And if ever a job deserves to have these big words, this one does. And so essentially, someone goes into a hospital, they get checked out for something. It is on the list of things that you are kind of keeping tabs on. And the hospital says, oh, okay, we need to report this to public health because they're keeping tabs on this. And then that enables you to give that information to public health officials or disseminate that information to wherever it goes so that people can be aware that this is potentially, it's like a way of getting ahead of a problem before it starts.
Yeah, we try our very best to keep a good pulse on different patterns of conditions, diseases, so that we can anticipate or we can track to see if there's going to be increase and what the steps we need to do to tackle on those conditions. And I just remembered, I forgot to answer one of your questions, Tony. Correct. So King County is the local health jurisdiction in Seattle. In different counties like Pierce County, Tacoma County, there's also their local health jurisdiction. But going back to your question about, yes, King County, we do like to keep monitoring, or surveillance as you call it, because it's so important for us to really have a good idea of emergent diseases so that we know what types of interventions work best, and really and to protect people. And also we worked with, there's a few things we do besides for surveillance of certain diseases. We also work with healthcare providers. For example, with the Shigella outbreak, over, I believe, 100 to 110 people have been hospitalized, or have been confirmed cases so far. So, and with Shigella is a diarrhea illness, and there's been some antibiotic resistance to that. So we work with the healthcare provider to guide in treatment. For example, we might find out that a certain patient is resistant to a certain antibiotic. We will work with the healthcare provider to recommend another antibiotic that is more effective so that the person can get the right treatment.
See, I'm seeing how this could be beneficial to communities. As an example, if you find out something happens, it could be in the water, and you may be able to tell again in a geographic area if a number of people are having this same disease happen, and that's kind of the work that you do as the investigator. Now, do you coordinate, partner with the same department in other counties? Do you share information? Do you all kind of work independently? Do you all know, hey, we got a hot spot over here, and you alert each other to it? How does that work?
That's a really excellent question, Tony. Yes. Besides for our cloud partners, healthcare providers, different facilities, long-term care facilities, various partners, we do keep in touch with other counties. Our cases are defined by a person's residence. So if they are a resident of King County, then, it will look likely we get the case. If we get another person whose residence is maybe in Pierce County, then we do like a warm handoff and we notify them and say, we have a case here. This person belongs to you. And obviously, we keep in touch with our partners as well, because, if something were to happen in King County or, another county, we want to make sure that everyone is alert and updated and kept abreast of the situation if needed, because really it's a collaborative effort. We couldn't do this without, our partners and without the public's help.
You're listening to Rainier Avenue Radio. My guest again is Stacey Pham. And one of the things about this, when you start talking about communicable diseases and immunizations, this can be scary for folks, for a lot of different reasons, because then it comes down to, trust the government. And that's what we're told to do. And it was the same thing with coronavirus. Again, it was exacerbated, and it causes confusion because of the science in a number of different areas. Even as simple as wear the mask. Don't wear the mask. But what you're doing is science-based research. Correct me if I'm wrong, and tell me, how in this particular instance, our communities can be comfortable with what you're doing, because again, you said you're asking for information, and people get kind of nervous about asking for information. What are you going to do with my information? Where is it going to go? What is it going to be used for? Does this mean our community is going to be targeted? These may be some of the things that people have thoughts and questions and issues to as we're using this. but this is about collecting scientific information and aggregating it, and that's what you do. Now, this also gives you information, and the impact that it has on society can be critical because it can determine trends in certain communities, which is ultimately what I was getting back to. But let's talk about the science part of what you do, and do the politics at all play a role into the information that you have and how it's used, in various communities or under circumstances?
Can you clarify that a little bit? Politics.
Just say, for example, somebody might say, "Well, okay, I've got public health contacted me, and they're saying I have something, and they're asking me where I ate." I don't know if I feel comfortable about that, because if I mention the restaurant to them,
got it.
There may be some backlash on my favorite restaurant in my community.
Yeah. Thank you for elucidating on that question. Public health is not here to reprimand people or to judge people, or the main goal of public health is, like I said, to prevent disease transmission and outbreak and protect the health of the people. The information that we collect from the public is confidential. People, and we work with different types of partners. We have, for example, environmental health. That's one of our departments. When we identify maybe a restaurant that several people have said that they got sick from, they go out and they do their own investigation. Again, we're here to just regulate and to make sure that people are people are following the right protocol in terms of food service or different types of other protocols. And really, we really just want to help people to either remain healthy or to become healthy. And we are not here to do any of that kind of stuff. That is mainly our goal, and the public's interest is always on the forefront of what public health does. And the public.
How has this past year, this unanticipated challenge for everyone of coronavirus and the pandemic impacted and affected you, what you do? Obviously, we've all become aware that there's these things called diseases out there that can be communicated and passed on. And then there has to be an immunization. And then there's a study of it. And then there's, oh my gosh, we need to find out where it's at so we can track it. And but under a pandemic, because that's not the only part of what you do, how has this impacted the work that you do?
Prior to working with King County, I started last September. Before that, I worked in South Sudan. So I've been with the county maybe 8 months or so. From what I hear from my colleagues is that when COVID first started, it took top priority, and they were just bombarded with, and inundated with so many cases that they were really, they really had focused their entire attention on that. So as a result of that, some other types of conditions may have been put maybe on the back burner a bit. However, with time, as now we are in, 14 months into this pandemic, we've had to adjust and modify our programs accordingly, because we realize that it's definitely modifiable for us to adjust with the conditions, the environment, and that's what we've been doing so far. We're working through some backlogs, and I would say that probably right now we have a pretty good system of modifying our workload so that we make sure that if new types of conditions come in, we're able to take care of it and handle it in an appropriate manner and timely manner.
My guest again is Stacy Pham, disease research and intervention specialist, public health, Seattle and King County, talking about communicable diseases, epidemiology, and immunizations. You mentioned Sudan, and how has the travel, the ability to see other places, how has this impacted? And you mentioned this is where you chose to go. How has that impacted your worldview, impacted your concept of public health? Which is probably different. I mean, there's a lot. It's different, even in this one city. Public health. It varies from neighborhood to neighborhood. So there's a micro picture and a macro picture. But how has it impacted your view of the world, or your worldview impacted your perception of public health?
Yeah, thank you for asking that question. Want to give a little background. So I was born in Vietnam and I lived there for 7 years. And Vietnam is like a low to middle income country. It's a developing country, and growing up, we didn't have a lot. I remember my stories of my mom. She would, get sick, or like, me getting really sick, and we couldn't afford medicine. So, and then my parents and I, we immigrated to America, and to see people suffer so much. And when we first came here, we didn't have a lot. And we see that, we were being helped. And I think because of my upbringing and my childhood and how I was raised, I just developed a deep love for service, a deep love for serving others and trying to help others because of what I personally went through and personally experienced. And that culminated in my work overseas with the Peace Corps and different types of non-governmental organizations. When you're overseas, you just see like so many different experiences, different people. And I think that people normally who do work overseas, they really have this, deep and great desire and passion to help others. And there's a lot of suffering, and you become you're humbled by it, and it's heartbreaking and it's unnerving. And you also, like a person, also learns so much from working overseas. So my perspective on public health is not only shaped by my childhood and growing up in a low-income county in Southern California, but also by my 4 years abroad. It's really made a significant impact on my life, and because of all of that, I chose to do what I do, and I chose a career that really speaks to my heart, and that's what public health is for me.
Well, I really appreciate you coming on, Stacey. And this could have been in so many areas. And of course, the pandemic impacted the work. It impacted everything. And that's, folks are now aware of another way when they say our public health resources were strained.
Yeah.
That was a big domino effect. And as I'm listening to this conversation, we did a 3-day summit for Earth Day. And this could have also been part of that environmental justice those conversations that we were having. And that's why I thought it was so important to have you on and explain the work that you do, so that we find out about things that are happening in our community before it's too late, because that is often the case. I want to give you the opportunity for final words here, because I've been firing questions at you. But if there's anything that you just want to say or you want to share, whether it's about your work, your background, go ahead.
Thank you so much, Tony, for having me and giving me a chance to talk about public health and promote it. I would say the main message is that public health, we are here to really guide people and to help people and to ensure that, people stay healthy. And if they're not healthy, then to help them be healthy. And I think that being on the show helps to kind of demystify that whole, distrust a little bit, and it helps also to put a face to public health as well. Regarding, we mentioned it briefly about vaccines. I just want to also mention that vaccines, we have a lot of appointments for COVID vaccines. You can get them at the Auburn Outlet Collection. I'm sorry, I made a little note to myself, so I'm reading it right now. It's also at the Kent Shower Center, Monday through Saturday, 9 a.m. through 4 p.m. You can access this information via kingcounty.gov/vaccine. It's free flu vaccine. You can do walk-ins. People who are 16-year-old and plus are eligible, and free regardless of immigration status, regardless of citizenship. And it's just something that we hope people partake in, because right now with the pandemic, we really need to kind of get the word out there, and that so that people know where they can get vaccines and where the resources are. And I want to thank you too, also Tony, for putting up resources on your radio station. I saw that there was different resources for food giveaways, and it's just so important right now, such a priority, because people are really struggling in the pandemic, and it's affected our jobs and our work. And so I really thank you for just helping the communities.
Well, thank you. And for those of you who are listening, I hope you enjoyed this conversation. For those of you who are watching, whether it be on Facebook, YouTube, or Twitch, Another one of the things that I wanted to do in a critical situation like this was pull the curtain back, because I also think it's important in the community that I live in, which is very diverse, that people see that there are people who look like them, and have shared identity and shared experiences, especially when you're talking about things like diseases that folks don't understand or don't know about, and you're hearing about, and they're being tracked, and immunizations and community health. So thanks, Stacey. Was this your first interview? Is that what you told me?
This is my first radio interview. Yes, hence the nerves. I'm very nervous.
Let me give you a round of applause. Great job.
Thank you.
Thank you for sharing this information, Stacey. You've been listening to Rainier Avenue Radio's broadcast of the impacts of the coronavirus on South Seattle and surrounding communities. I'll do a little shameless plug. Public Health Seattle and King County is also a sponsor of our broadcasts of high school basketball. And so tonight is a pretty big game. At 3:45, Eastside Catholic will be taking on Garfield. Girls and boys. Boys game starts at 7:30. So tune in tonight, and that broadcast is powered by Public Health Seattle and King County. So just again, great work that you do, Stacey. Good to get it out in the community and let people know what's going on. That's it. That's all the time that I have. That's going to do it for the kid. It's me, Tony B., your host of the impacts of the coronavirus on South Seattle and surrounding communities. And remember, whether you believe you can or you believe you can't, you are probably right. I'm out. Peace.
Have struggled through the COVID-19 pandemic. Many of our communities have been particularly hard hit. Some things definitely need to change, but a few things should stay the same, like protecting your child from serious diseases you can prevent now. Preventable diseases like measles, mumps, and whooping cough. Is camp, childcare, or in-person school on your family's agenda? Give your child a healthy and safe summer and school year by making sure they're up to date on vaccinations and well child visits. You have the power to protect. Call your healthcare provider to find out what vaccinations your child is due for and make an appointment today. If you need help finding a provider, visit parenthelp123.org or call the Help Me Grow Washington hotline at 1-800-322-2588. An interpretation is available.
1, 2, get down! What's up, big and little homies? This is Masvita Maraire, host of Seattle Sports Weekly on Rainier Avenue Radio.world, your one-stop shop for Seattle sports. We cover preps, we cover college, we cover pro, we cover it all. Huskies, Mariners, Seahawks, Garfield, South, Roosevelt, Metro, King County. This is where you want to listen to for all the sports that's happening in Seattle. Seattle Sports Weekly on Rainier Avenue Radio.world.
Dealing with COVID-19 is uncharted territory, and everyone has different challenges. People may feel anxious, down, or overwhelmed. For some, these feelings can lead to changes in sleep patterns, an increased use of alcohol or drugs, or withdrawing from the people around them. If you know someone who's having a hard time coping, you can help by reaching out to talk and listen. To learn more about how you can help someone in need, call the Suicide Prevention Lifeline at 800-273-TALK. Brought to you by the state of Washington.
This is Rainier Avenue Radio.world.
Welcome to Rainier Avenue Radio.world. Welcome everyone to this Friday's edition of the impacts of the coronavirus on South Seattle and surrounding communities. It's me, Tony B, and yes, we continue this series of shows where we discuss how COVID has and continues to impact our communities, our lifestyle, our politics. It impacts and affects pretty much everything. So now we are coming out of restrictions And that in itself is a change, although for some folks, it could be a chance to get back to what, normal feels like. There are certainly folks who want to go back to something else. And of course, this transition for some folks is a little scary. You just got used to COVID, got used to the things that COVID has put upon us, the way we interact, the way we get our messages. And in some cases, a lot of folks have been more comfortable wearing masks. One of the benefits of it is that it did reduce the number of flu cases that we had last year. So there's just a lot of things that are impacted, by the letting up of restrictions. Washington State, I believe, was the first state in the country to reach the 70% vaccination rate among 12 and older. Now, that's statewide. Having said that, that doesn't go across the board to everybody. And racially, there is a difference. Only 50% of African Americans, as an example, have been vaccinated or received their first shot for vaccination. My guest joining me here is going to be talking about the Rainier Valley Food Bank. The busiest food bank in the Seattle area, serves over a million meals annually. About a week ago, they announced that they had acquired a new building, and that the new building will transform their ability to serve the growing demands of the communities that have been hit by COVID-19's impact. So it's situated in the heart of Rainier Valley. For over 25 years, Rainier Valley Food Bank did see a significant increase in the demand for its food programs while working in a space that barely contained the staff, volunteers, and donations needed to meet the growing community needs. Right down there, just north of Genesee on Rainier. So, new things happening with the Rainier Valley Food Bank. And then also there is an executive director who is fairly new to this position as well. So I'd like to welcome to the program Gloria Hatcher Mays, the executive director for the Rainier Valley Food Bank. Gloria, how are you?
Hi, how are you doing? It's very nice to see you today, Tony. How's your day going?
Under the circumstances, fantastic. I do have to say, we had a little cool down yesterday, which is cool. It seems like the heat is back. I don't know what the temperature is, but I know when I'm hot.
That's the best thermometer, Tony.
not 109 like a few days ago, but I know when I'm hot. So I don't know what the temperature is yet, but I steps outside of the house and it's hot. Gloria, sometimes I give background information on folks, but then, I like the audience to hear from the guests that I'm talking to. So I've got a bunch of information here on you and the work that you've done, but I thought it would be better to let you give a little bit of background information on who you are. And let's just start with that. Again, I'm new executive director, as of May of 2019. Gloria Hatcher Mays for the Rainier Valley Food Bank, which is again been a fixture in our community. I did give some details earlier about the number of folks that the Rainier Valley Food Bank serves. Gloria Hatcher Mays, how are you? Who are you?
I am really, really great. Thank you so much. And in terms of who I am, I've been a resident of the city of Seattle my whole life, with a brief foray into international travel because my father was in the Army. So I spent a little bit of time in Germany and actually used to speak German fluently, which is odd for somebody to do, but I've lost all of that skill. But I'm sure that you care more about my career life, and I view myself as a change agent. I worked for a large telecommunications company for over 20 years. And when I left employment with the big Fortune 500 gig, I decided I really wanted to do something that resulted in helping people. So I went into the nonprofit sector. And as an executive director, I have operated the food bank at Pike Market and their senior center for a few years. I did a little bit of time in the healthcare industry as an executive director and found my way to Rainier Valley Food Bank a couple of years ago. I love what I do to serve the community. It's a wonderful organization to be a part of. And I am hopeful that the skills that I bring to the table to move the organization forward are going to serve us really well as we embark on our journey into our new facility. So we have some exciting things happening there.
So everybody's not familiar with the Rainier Valley Food Bank. I know for a number of people who do live in South Seattle, whether you have been there or you have just driven by, you're familiar with the role that Rainier Valley Food Bank plays in our community. So quickly, let's just talk about the Rainier Valley Food Bank for anyone who may be unfamiliar with who the Rainier Valley Food Bank is, what you do, who you serve.
Okay, so we are an organization that really places food at the center of everything that we do. We are an organization that has 4 different channels to get food out to the community. The most prevalent one is an in-store grocery store that we run out of our little facility there right at 4205 Rainier Avenue South. And when the pandemic hit, we had to close that down. So one of our other channels, our home delivery program, became our primary method of being able to get food to people in need. And we did that because there are 2 really critical things about COVID, which I know that you already know, but people needed to stay home and they needed to stay safe and sheltered, but they also needed to find pathways to still get the services that they needed for their families. And most of the people we serve would come on the number 7 bus line to arrive down at our facility to do their grocery store shopping. So we knew we had to figure something out and we needed to do so quickly. And fortunately, the community rallied around and helped us stand up this whole new service delivery model, moving from about 100 cars that we were, 100 households that we were delivering to over 1,000 households that we were delivering to in this new home delivery model. So it was a monumental undertaking to be able to do it. But
I'm going to stop you there for a second and remember where you were, because I'm not just going to let that go by. You went from delivering to about 100 households to delivering to about 1,000 households.
That's absolutely right.
Wow.
The program was originally designed to serve people who were unable to reach us because they couldn't get transportation or they had a health issue. And so their doctors would sign off on the fact that they really needed to get food from us. So we would travel to them and deliver it to them pre-COVID. But with COVID, everybody fell into that category. They really needed to stay home. There was an air traffic controller who was on furlough from his job, and he helped us identify the logistics that we needed to be able to shift to that model to give us the capacity to be able to deliver to that number of households. So it is as big as it sounds. It requires us to have volunteers who are willing to drive the routes for us. So every week we have between 50 and 75 volunteers who show up to pick up the routes, pick up the groceries, and drive to our neighbors and make sure that they have food. So,
I'm going to stop again, because as Rainier Avenue Radio, one of the things that we do is, of course, we amplify the diverse voices of our community. Of course, we report on the things in our communities where there are concerns and where there are issues. But the other thing that we like to do is we like to shine a spotlight on all the amazing, incredible things that happen in our community, the people who live in our community, that support our community, because a lot of times on mainstream media, the only time you hear about South Seattle, Rainier Avenue, is when there's a crime or a shooting or something like that. So that's just amazing. So before we go any further, we're just going to give you a round of applause for serving our community and the work that the Rainier Valley Food Bank has done in this time of crisis. That's awesome. And you know, I think that. So anyway, continue. Good job. I have some other questions that may not be as easy to answer, but I got to give props where props is deserved. That's a wonderful thing to hear about our valued food bank. That's awesome.
Yeah, you know, Tony, I really need to give a round of applause to our neighbors. You know, the people in our community who do step up and step out and get this done. I mean, it was risky for them to be able to come out of their homes to do this, but we developed a strategy to keep them safe too. Our volunteers were always protected. They were able to do these deliveries without risking their health, but they didn't have to do it, and they did. They showed up for us. So that really speaks to the caliber of folks that are in our community, and I think that they deserve a round of applause as well.
Now, how long was that gap between the initial shutdown back in March of 2020 and the ability to organize, reorganize, recalibrate, and then start getting food to people? How long was that gap? How long were people isolated and essentially who depended on you for subsistence? Did they have to figure something else out?
No, and here's the thing: when it happened that we realized that we were going to have to shift into that mode, in planning meetings with my staff about what we were going to do, the first thing they told me is, we'll do anything you want, boss, but we're not going to close. So we never shut down. We stayed open the entire time. And as people would come for in-store shopping, we would give them instructions on how to sign up to get their groceries delivered to home. So we did sort of an overlay of our program so that we could shut down without people missing their groceries at all, ever. And I'm really proud of my staff for that too, that they were really committed to making sure that their neighbors, their clients, the people that they cared about, continued to get the food and the items that they needed. It's not well known, but we also give out things like baby formula and diapers. It's a big part of what we do. So there was just no way we were going to be able to shut down at all.
My guest again is Gloria Hatcher-Mays, Executive Director of the Rainier Valley Food Bank. And you have a new building. So let's find out about that too. But thank you for sharing that story. Would love to get information out about the mighty Rainier Valley community, how we get down. So you've got a new building. Is that correct?
We have a new building. We're so excited. We are so excited.
Where is this new building? How long has this been in the works, and how's it working?
Well, this has been in the works for over 5 years. The board and the staff have had a vision for this that predates my tenure with the organization. So when I came on board, we were headed down a path, and that path got derailed. And suddenly a miracle happened and a building became available. It was within the range that was within striking distance for us to be able to afford it. And we closed on it in May of this year. It is taking us from having a space of, I think I mentioned 1,200 square feet to well over 5,000 square feet.
Wow.
And we have plans in the works to even increase to almost double that by the time we're done with our remodeling activities. So it is a huge opportunity for us. The space is located at 9021 Rainier Avenue South. And some folks in the community will probably recognize that address because it was formerly owned and operated as the Southwest Mortuary by Bonnie Watson.
Okay.
And we know that it is a space of deep spiritual connection for a lot of folks in our community. We understand it was a place where they would go and celebrate the lives of their loved ones. And we really want to be respectful of that. And so one of the things that we're doing right before we even move into the building is connect with community members to hear from them how we can honor the space from its history into its future. We want to continue to celebrate life in that building, only this time we're going to use food as the point of celebration. Nourishment, care, building community, making it a space where community members can gather and be a part of what we're trying to build there as a community hub, a community food resource, and a community resource for many different things, like if you need help with your rent, if you need help with transportation, we have a plan to develop programs that will provide short-term job skill training to help people get higher waged jobs, working in box stores, for example, or in culinary arts, working in the restaurant industry. And so this building is really a pathway for us to realize a vision of our future that we've had for a very, very long time. And we really do hope the community will join us and reach out to us if you want to be a part of this, be a voice for your neighbors too, and let us know what your needs are for this space and for the building. We really want to hear from people and make sure that this is a community-led effort to rebuild a community food center right in Rainier Beach.
Now, for folks who need your services, as we know, that need never stops. What can they do? What should they anticipate? What should they expect? Can they drop in? Or are there appointments? Are there certain days? For anyone who needs the Rainier Valley Food Bank right now and what you provide, what should they do?
Well, the first thing that they should do is visit our website, and on the website will be information that will
Okay,
help
I'm going to
them.
stop you there because
Okay.
everybody doesn't have a website. I think you know that.
I do know that.
So let's start from that level. You don't have a website. You're hungry. You need to feed your family. So let's start from there.
Okay. Well, there's two other ways that you can reach us. You can come on by and we'll sign you up so that you can start to receive food for your family. We would add you to our home delivery program because we haven't yet reopened for in-store grocery shopping yet. We also have a program where if you are unsheltered or you don't have a kitchen or a way to prepare your food, we can give you immediate groceries that you can consume without having to cook them. They don't require heating. And we distribute those bags every day that we're open. So Tuesday through Saturday, you can stop by and you can pick up food. We always have items that are available to secure while you're there on site with us. We'll give you a grocery bag and fill it up for you. But we really want to make sure that when we reopen, we're doing so in a way that will still respect the fact that we aren't yet done with the COVID virus. And we really want to make sure that you don't get sick. I also heard you mention in the lead into this interview session that only 50% of the African-American community have gotten their vaccines. And one of the other things that we can do is help you get a vaccine. We do have the health department that runs a pop-up clinic at our site occasionally, and we can make sure that you have the information about when to stop by so that you can get a COVID vaccine and to protect you and your family and keep you safe and healthy. The second way that you can reach us is to give us a call. If you just reach out to us by phone, we can take all of the information over the telephone and make sure that you get your needs met. If you need an emergency delivery of food, we can probably take care of that for you when you call. And I can give you the phone number to call directly and just tell them you want to get on board. You want to join the community of folks that we serve, and we can make sure that that gets taken care of for you.
What's that number?
It's 206 723 4105.
723-4105. We'll probably get that number up and share that number with folks as well. I'm going to talk again a little bit more about the Rainier Valley Food Bank, but I'm going to get in your Kool-Aid here a little bit because you brought it up again about 50% of the Black community that when I initially listened to that has not received even a first vaccination. Now, at Rainier Avenue Radio, we understand, and we understood from the beginning that everyone wasn't going to be on board with this, and we understood some of the reasons why, in particular in the Black community. So this isn't, on you speaking for Rainier Valley Food Bank. This is just your personal thoughts on this to see where you stand on it. And if you don't want to comment, you don't have to. But what we've also seen is a decline in other vaccinations across the board and for the Black community. So we're talking about measles, whooping cough, mumps, things that we have gotten vaccinated for so that they no longer ravage our communities. Again, with coronavirus, we had too many countless myths and disinformation and misinformation out there to even start discussing what they were. But it definitely, caused people to pause about, hey, should I or should I not get vaccines? This whole process about it. At this point, for me, I would hate to see our community be re-impacted by some things that aren't impacting our community again, like measles. Now there's still the vaccine, and we know now that the people who are going to the hospitals, the people who are dying, are people who are not vaccinated predominantly. What are your thoughts as a person in the community? You said change maker. When I say that, about only half of the Black people in the state have gotten vaccines. What do you say to that?
Well, first of all, I understand why there might be some hesitancy. So, the first thing I always think about is honoring where people are, and making sure that they know that I'm respectful of where they might be coming from and the decisions that they're making about their own personal well-being. I would also say, though, I would testify. I have to tell you, my husband was sick with COVID and nearly died. He was in the hospital from March, the entire month of March last year, and came home and had lost about 40 pounds. Could not walk, had to relearn how to walk and take care of himself. I mean, you do not want this disease. And I know a lot of folks feel like it may not be real, or someone might be trying to take advantage of them with this vaccine. But I'm here to tell you that the ravages of the disease are so horrible that it's almost worth the risk to take the shot. I myself have had both my vaccines. I had the Moderna vaccine. I had no ill effects. And I think that's what it takes, Tony. It takes people who are being real with other people, that are trusted advocates, people who can share their personal stories, that aren't trying to shine them on, that aren't trying to give them a lot of information that's not real. And that's how we convince people, and it's one-on-one conversations with your neighbors to let them know your personal experiences, and why it matters, and why it means that we can really get rid of this virus in our community once and for all. It has devastated the African American community worse than most other ethnicities. And we need to protect ourselves. We can't count on anybody else to do this for us. We need to grab the reins and drive this forward, because we say so, because we have found for ourselves what works. And I think that that's what's going to make the biggest difference.
Gloria, I've talked to folks, obviously, months after this has started, and some of them who have told me, I wasn't going to get it, the vaccine. I believed this or I believe that, who've come to me and said, I had it. And almost verbatim to what you said, they say, you don't want to get this. And so I think getting those stories out there from people, who may have been skeptical, but I'm not even talking about the people who come to me and say, I lost my grandmother, I lost my aunt, I lost my cousin to COVID, because you can still take that back to them if they are not vaccinated and you are not vaccinated. So I sidebar for a minute. I just wanted to get your personal perspective on that, since you work very closely with community members, and you are giving away the vaccine now, so that it is available, and it is available, whereas before it wasn't available. So now it is. So okay, back to Rainier Valley Food Bank.
Yeah, well, the vaccine is part of our story, I have to tell you, because we really want to be a one-stop shop for our community and our community members. And having vaccines available right at the food bank is part of why we aren't a traditional model for a food bank. A lot of people think we only do one thing, but we do so much more. And if your listeners take away nothing else, know that we really want to be a resource for them. You can come to us with any question, and even if we don't offer that particular service, we will not leave you. We will get you connected up to someone who does and make sure that your needs are met. And that's how we want to be viewed. And when we grow into our new building, we'll have more space to do even more of that type of work to lift up all the whole community. You know, that's our vision. That's our dream. We want to be a community hub, a place of access, a place where people can gather, a place where people can plan, a place where people can learn, a place where people can grow. And it all starts with food. And if they take away nothing else, know that's who we want to be for you. And we'd love for you to come get to know us better.
I'm excited to share Rainier Valley Food Bank with our listeners, those who are watching on YouTube and Facebook, those who are listening to us on our affiliate stations, and of course, Rainier Avenue Radio app. This is just really appreciate the work that you do. For folks who want to maybe volunteer or donate or want to give back or want to support, and they want that support to go to Rainier Valley Food Bank, what can they do? How can they get down?
We have a lot of different ways. We do, again, to the website, but you can call us too.
We're going to assume some of these folks who want to give have websites, but if they don't, they can still give. So you can share that website information. I just had to make sure we took care of the people who may not have had access for that other information. But yes, tell them what they can do digitally as well as physically.
Okay. Well, we love it when folks like organize food drives for us, for example. We still are taking food donations. Another way that you can help us out is by clicking on that volunteer button, and you can let us know how you want to volunteer. We have lots of different options available. You can become one of our drivers. You can help out with administrative work. You can make phone calls to clients to make sure that they know about any changes to our delivery schedule and things like that, to make sure we never miss an opportunity to get food out to folks. You can make donations to us. It really is helpful to us. Any amount of funds that you can afford to give us, we are so very happy to receive. We have a woman who gives us $1 every month, and we keep it in a little envelope. And when we get up to $10, we try to find a way to spend it on our volunteers. So everything counts, everything matters, and everything is helpful. And you can either access the website to figure out how to do that volunteering or that donation, or you could give us a call directly at the food bank. The same phone number as accessing food services will work for you to volunteer as well.
Well, Gloria, it's great to have this opportunity to meet you even virtually. Appreciate the work that Rainier Valley Food Bank has done in our community for years and the direction that things are going right now. Know that you always have a home and a place to share your stories right here on Rainier Avenue Radio, your community radio station. I got about 45 seconds left that I want to use to give you the opportunity for final words.
Well, thank you so much, Tony. As I mentioned, we are the busiest food bank in the city of Seattle. We are serving over 1,000 households every single week. We love that the community has rallied around to support us and to help us grow. We are so thrilled that we're going to be able to move into our new building, our new space, and we would love to have community come out and support us. We are especially in need of your good thoughts about how you see us growing into that new space and into and expanding our program. So again, I invite you to contact us, to communicate with us. We'd love to hear from you. It's very important to us. And I also want to tell you, Tony, if you ever want to come by for a visit or you want to broadcast out of our space, you just let me know. You can come on down.
You know what? I think we're going to make that happen. I'm sure we're going to make that happen. Gloria, great talking to you again, Executive Director of Rainier Valley Food Bank. Gloria Hatcher-Mays. It's me, Tony B. This is the Impacts of the Coronavirus on South Seattle and Community show. And something we do every Friday. We're going to take a little break right here on all of our audio channels. Make sure and stay tuned. We'll have more information for you on the impact of the coronavirus on South Seattle. We'll be back.